And a new study shows the coronavirus has become a literal nightmare for many of us. Researchers in Finland use artificial intelligence to analyze the dreams of nearly 800 people. More than half reported dreams that were pandemic specific. The dreams consisted of themes such as failures in social distancing, personal protective equipment, and coronavirus contagion. More than a quarter of those people also reported more frequent nightmares since the pandemic began. And approving a COVID-19 vaccine is only half the battle. Health experts must next figure out how to distribute it and who gets it. Sarah Doloff has the story.
The race is on to develop a coronavirus vaccine and distribute it ethically and efficiently. In Massachusetts, the bulk of Acme Dry Ice's business is from vaccine manufacturers.
We've gotten calls as far as California, Seattle, Chicago, Texas.
Several of the leading vaccine contenders must be stored at sub-zero temperatures. UPS building freezer farms. Hospitals and states asked to plan now.
This is definitely probably the most daunting task that we've had to undertake.
The first doses will likely be limited, possibly covering as little as 5% of the country's population.
The first round or two or three of vaccination won't be sufficient to achieve that level of population immunity.
A CDC advisory group is recommending those initial doses go to healthcare workers and high-risk groups, expanding to others as more doses are manufactured and possibly more vaccines approved.
There are different platforms to deliver the same technology, essentially. So I fully agree that if a vaccine works, we'll likely have multiple vaccines.
All Americans likely will have access to these new weapons in the fight against COVID within a year to a year and a half of their approval. Each phase in the process complex and critical.
Another challenge for health experts, convincing approved vaccines are safe and effective. A recent Pew study found only 50% of Americans say they'd probably or definitely would get a COVID vaccine. And a new survey reveals just 59% of American adults plan to get a flu vaccine this year. A new data suggests release a virtual news conference from this morning from the National Foundation for Infectious Diseases and the CDC. Health officials said these numbers are concerning because of the potential dual punch of the flu and COVID-19 this winter. Panelist Dr. Anthony Fauci urged Americans